What is it? When a parent or caregiver, rather through an action or failing to act, causes injury, death, emotional harm, or risk of serious harm to a child. There are many forms of child maltreatment, including neglect, physical abuse, sexual abuse, exploitation, and emotional abuse. Why is prevention important? Child abuse and neglect can significantly affect the way a child grows up and how he or she develops and acts as an adult. The physical wounds may heal, however, there are long-term consequences to child abuse, especially if the child is an infant or toddler and has had trauma to his or her head or back that could potentially affect how their brain functions. In addition to long-term physical consequences, an abused child may not have the proper ability to cope and thrive as an adult due to their trauma, and they may require long-term counseling before being able to overcome past experiences. Those who have been abused are at a higher risk for experiencing both cognitive delays and emotional disabilities due to both the consequences of trauma and the consequences of isolation and lack of necessary care. These children are also at a higher risk of health disparities, including a dysfunctional nervous and immune system. It is essential that in both the healthcare system and in the criminal justice system that we identify early warning signs of abuse and research ways to prevent and lessen the occurrence of child abuse. How can it be prevented? The American Prosecutors Research Institute of the National Center for the Prosecution of Child Abuse provides extensive training, resources, support, and advice to prosecutors, police, social workers, and others involved in the prosecution of child abuse cases. Examples of what needs to be implemented to prevent: parenting classes for new parents and parents within the system. The Safe Start program, which emphasizes multidisciplinary approaches for preventing and intervening with crime and violence among children. Prevention and criminal justice. A report must be made when the reporter suspects or has reason to believe that the child has been abused or neglected. Beyond home visits, simple support groups or after-school activities for children can help prevent child abuse within the home. The community can get involved to prevent child abuse through 7 steps to protecting our children from sexual abuse outline, created by the Kids First Abuse Treatment Center. The 7 steps include: learn the facts and understand the risks. Realities, not trust, should influence your decisions regarding your child. Minimize opportunity. If you eliminate or reduce one adult, one child situations, you will dramatically lower the risk of sexual abuse for your child. Talk about it. Children often keep abuse a secret, but barriers can be broken down by talking openly about it. Stay alert. Don't expect obvious signs when a child is being sexually abused. Signs are often there, but you have to spot them. Make a plan. Learn where to go, who to call, and how to react. Act on suspicions. A child's well-being may depend on it, and get involved. Prevention and nursing. Home visitation programs are used to assist families with young children and promote an effective way of preventing child maltreatment. A study conducted by John Eckenrode showed that families who receive home visitations during pregnancy and infancy have significantly fewer child maltreatment reports involving the mother as the perpetrator. When children are brought to the healthcare department, it is important that the nurse assesses the child's full body and signs of abuse or neglect. In order to learn these signs, nurses can take classes that identify warning signs such as burns, bruises, at the different stages of healing, fractures, and malnutrition. As nurses, we are mandatory reporters of child abuse and neglect. Financial cost. A CDC study found the total lifetime estimated financial cost of 1 year of confirmed cases of child maltreatment is approximately $124 billion. 10% is federal funding. That is $339 million per day our nation spends on child abuse and neglect. There are many different aspects you must include in the cost: foster care services, hospitalizations, mental health treatment, and law enforcement combined costs over $33 billion. $7.2 billion of federal funding is granted to child welfare. $4.5 billion is for foster care placement, and $2 billion is dedicated to child adoption. Other costs that add up to the staggering number of $124 billion are costs related to chronic health issues, education, and the criminal justice system. These all add up to become over $70 million. Cost of survival. The estimated average lifetime cost per surviving victim includes $32,648 in childhood health care costs, $10,530 in adult medical costs, $144,360 in productivity losses, $7,728 in child welfare costs, $6,747 in criminal justice costs, $7,999 in special education costs. Costs in law enforcement. The National Institute of Justice estimated the following costs of police services for intervention for each type of child maltreatment. Based on the number of victims and cost estimates, the annual law enforcement cost of child maltreatment is over $34 million. Total direct cost is over $33 billion. Adult criminal justice costs. The U.S. Justice Department estimates that the annual direct cost of adult criminal behavior is $227.6 billion. The National Institute of Justice states that 13% of all violent crime can be attributed to early child maltreatment. The total adult criminal justice costs attributable to child abuse and neglect is $32 billion. Juvenile delinquency. Research on the effects of child maltreatment reports a correlation between maltreatment and subsequent juvenile delinquency. It is estimated that slightly more than 1 in 4 maltreated children will engage in an active juvenile delinquency as an adolescent, compared to 17% of children in the general population, for a difference of 10%. A conservative estimate is that 125,660 maltreatment victims engage in an active delinquency each year at a cost of $26,652 per child, including administrative costs associated with the arrest, adjudication, and incarceration. The cost of delinquency is $3.4 billion. Population that is impacted. Child abuse and neglect can affect any child younger than age 18 and can occur across all ethnic, religious, socioeconomic, and educational backgrounds. Of the 6.2 million children reported to CPS as potential victims of child abuse in 2011, the government confirmed that there were 681,000 cases of child abuse and neglect. Of the 681,000 children affected by abuse, there were 1,570 fatalities, with 81.6% of deaths occurring in children younger than 4 years old. Statistics according to the National Child Abuse and Neglect Data System from CPS 2011 reports. The true occurrence of child abuse may be higher than CPS indicates because abuse is not always recognized or reported by adults. Who were the child victims? Victims in the age group of birth to 1 year had the highest rate of victimization at 21.2 per 1,000 children of the same age group in the national population. Victimization was split between the sexes, with boys accounting for 48.6% and girls accounting for 51.1%. Fewer than 1% of victims were of the unknown sex. 87% of unique count victims were comprised of 3 races or ethnicity: African American at 21.5%, Hispanic 22.1%, and white 43.9%. What were the most common types of maltreatment? More than 75% suffered neglect, more than 15% suffered physical abuse, and less than 10% suffered sexual abuse. How many children died from abuse and neglect? The overall rate of child fatalities was 2.1 deaths per 100,000 children. 4/5 of all child fatalities were younger than 4 years old. Boys had a higher child mortality rate than girls at 2.47 boys per 100,000 boys in the population. Girls died of abuse and neglect at a rate of 1.77 per 100,000 girls in the population. Nearly 90% of child fatalities were comprised of African American, Hispanic, and white victims. 4/5 of child fatalities were caused by one or more parents. Who abused and neglected the children? 4/5 of unique perpetrators were between the ages of 20 and 49 years old. More than 1/2 of perpetrators were women. 45.1% of perpetrators were men. 1.3% were of unknown sex. 4/5 of duplicated perpetrators were parents. Of the duplicated perpetrators who were parents, 87.6% were the biological parents. Other facts. Every year, about 1 million abused children, 15 out of every 1,000 children, are identified in the United States. 1 in 4 girls and 1 in 6 boys will have been sexually abused by their 18th birthday. Child abuse and neglect costs our nation $22 million every day. April is National Child Abuse Prevention Month. And always remember, it shouldn't hurt to be a child.